Hey all, welcome back to the Real Life Pharmacology Podcast. I am your host, pharmacist Eric Christensen. Thank you so much for listening today. We are going to be continuing on with the top 200 drugs, and I am on drugs number 21 through 25 today. And as a reminder, head on over to reallifepharmacology.com. Get your free PDF on the top 200 drugs. Great study guide, great refresher. Lots of good clinical pearls, things you're going to see in practice, as well as things that show up on board exams. So definitely a no-brainer. Simply an email will get you access to that. And then we've got updates for you as well when we've got new podcast episodes and other content available. All right, so number 21 is Valganciclovir. Brand name of this medication is Valcite. And mechanistically, what this medication does is essentially blocks viral DNA synthesis. It's actually a prodrug. Valganciclovir is converted to ganciclovir. And probably the most common use I've seen this used for is CMV, prevention, prophylaxis, treatment. So CMV stands for cytomegalovirus, and it is going to be most commonly associated with patients who are immunosuppressed. So transplant patients, HIV/AIDS patients, they're at higher risk for this infection than patients who have a normally functioning immune system. So adverse effects, boxed warnings. There are a bunch of boxed warnings that are associated with Valganciclovir. Hematologic toxicity, so that can be low white blood cell count, low platelets, anemia. It can actually impair fertility, so increase the potential for patients not being able to get pregnant, things of that nature. Fetal toxicity, birth defects can happen with this medication as well. That is another boxed warning. And then there's cancer-associated risks as well with this medication. So as you can imagine, there's definitely some pretty significant risks associated with this medication. But there are also some kind of generalized adverse effects as well. So kind of common adverse effects that you may see are probably GI related, so nausea, vomiting, and diarrhea. Diarrhea is probably going to be the most common adverse effect there. Other things you may see: insomnia, hypertension, headache, and then administration-wise, I did want to mention that if you give this medication with meals, it can actually increase the absorption of the medication, actually increase AUC, or area under the curve, basically a marker of how much is getting into the bloodstream. It can actually increase that by 30% if we give it with a higher fat meal. So there is some dose adjustments based on renal function changes. So definitely look that up. Pay attention to that if you know your patient has CKD or history of CKD or elevated creatinine, those type of things. All right, moving on to the next medication, number 22, we've got Lamictal or Lamotrigine. This is used primarily in seizure disorders or bipolar disorder, and maybe more specifically, bipolar depression is where I see it used more often there. One of the most highly testable things with Lamotrigine is the adverse drug reaction of rash. Okay, this medication requires a slow titration because of the risk for this rash. It can progress to Stevens-Johnson syndrome and be life-threatening. I remember a case many years ago now where it was inadvertently restarted on a hospital discharge at a high dose, and it ended up causing a rash for our patient. So be very, very careful with that. Be aware of that adverse effect. And again, definitely one that can come up on board exams for sure. There is a drug interaction I wanted to mention. Valproic acid can increase the risk for that rash. So we actually need to go even slower with the titration there. So again, a good one to pay attention there. Other adverse effects, GI is probably going to be most commonly reported. Nausea, for example. And then, as it is in most cases, if you've got a medication used to manage seizures or used for seizure disorder, it can cause some sedation and CNS depression. And certainly that's true with Lamotrigine here. All right, next medication is Fluconazole. Brand name is Diflucan. This is classified as an antifungal medication. Most commonly used for candidiasis, cryptococcal infections, tinea, blastomycosis. So again, fungal infections is where you're going to see this utilized here. Mechanistically, it blocks lanosterol 14-alpha demethylase, and that is important for ergosterol synthesis, which is a component of fungal cell membrane. So essentially, Fluconazole is going to block fungal cell membrane formation. From an adverse effect standpoint, what do we need to pay attention to? QTc prolongation. That can certainly happen with this medication. I've got a post on meded101.com if you want to dig into QT prolongation and things to monitor for and how high are the levels and numerous drug interactions and drugs that cause it. So if you just search QTc prolongation at meded101.com, you should be able to find that post if you want to dig deeper into that. I've definitely done plenty of content on QTc prolongation. Other potential risks, things that come up in board exams, come up in practice, hepatotoxicity. So that's definitely one to think about with Fluconazole. Skin reactions have also been reported as well. And then one other really, really highly testable thing is drug interactions. So Fluconazole can have some CYP3A4 inhibitory activity, can have some CYP2C9 inhibitory activity, and then QTc prolongation as well, as far as kind of collaborating with other drugs and increasing that risk. So I've got a whole podcast on Fluconazole, so if you go search that, on iTunes, or if you go to the website relaypharmacology.com and search Fluconazole, you're going to find that full podcast, and I go definitely into a lot more detail there on that. All right, number 24 is Atenolol. Brand name is Tenormin, and this is a beta blocker, as you could probably tell by the ending, the olol ending. Most common uses, hypertension, atrial fibrillation, and mechanistically it blocks primarily beta-1 receptors, which is going to lead to a reduction in heart rate and a reduction in blood pressure. Both important things when managing hypertension and atrial fibrillation. Side effect profile, obviously we can drop blood pressure too far, we can drop pulse too far. So bradycardia, hypotension, definitely things that we're going to be monitoring for, certainly. And then we've got fatigue. That's definitely something I've seen patients report with the use of beta blockers. Sometimes it can just be mild and, patients kind of work through it and they, end up tolerating it just fine over time. Sometimes it can be very, very significant and, we have to utilize a different medication because it's caused too much fatigue. Now, Atenolol is primarily beta-1 selective, but if we, maybe get to higher dosages, we can have some beta-2 blocking impacts as well, and certainly that could worsen patients who have respiratory diseases like asthma and COPD. Remember, those beta-2 receptors are found on the lungs, so if we're blocking those, it can worsen some of those respiratory conditions sometimes. Other adverse effects, dizziness, erectile dysfunction. That's definitely one to remember. I've seen come up in practice. And beta blockers, as far as antihypertensive go, can cause this issue and definitely are one we want to avoid if patients do have this issue. And then last but not least, with beta blockers, Definitely, I've seen it come up on exams. It can kind of block some of the signs and symptoms of hypoglycemia. So in our patients with diabetes taking insulin, sulfonylureas, this can certainly be a risk or something to look out for there. All right, and before we finish up the last one, definitely want to remind you guys, if you're looking for pharmacist board certification exam study materials like NAPLEX, ambulatory care, BCPS, and so on, go check out meded101.com/store. We've got a great list of resources there. If you're looking for fun stuff as well, if you're a pharmacy technician, a nurse, med student, PA, nurse practitioner student, we've got crossword puzzles, we've got fun different books on case studies, drug interactions, all sorts of resources can be found at meded101.com/store. That can definitely help you learn pharmacology better and become a better clinician in general. So go check those out. Support the sponsor, meded101.com/store. All right, last drug, number 25, is Montelukast. Brand name is Singular. And this is a leukotriene receptor antagonist. And leukotrienes tend to be an issue in allergic rhinitis, asthma, for example. And so by reducing those leukotrienes, we can have some positive impacts on some of those disease states. So primary uses, I probably see allergic rhinitis a little bit more than asthma, but those are the big two there. Really, really important to remember the boxed warning with this. This will definitely come up on board exams with Montelukast. And there is a boxed warning for psychiatric events. Aggression, agitation, increased risk for depression and suicidal thoughts. So definitely a good one to remember there. Other adverse effects, usually it's pretty well tolerated, at least in my experience there. And then from a drug interaction standpoint, we really don't, have a ton of drug interactions with this medication as well. It is oral, so it's not nasal or it's not, oral inhalation or anything like that. So that can certainly be an advantageous thing for some patients. And like I mentioned, drug interactions don't have to worry about. Biggest thing is definitely that boxed warning for psychiatric events for sure. All right, well, I think that's going to wrap up the podcast for today. Thank you so much for listening. Do me a huge favor, leave a rating, review on iTunes, wherever you're listening. Be sure to share us, friends, colleagues, classmates, anybody who could benefit from pharmacology education. I greatly appreciate that. We're well over 4 million downloads, which is just mind-blowing to me, and that's simply from you guys sharing this podcast, helping others learn pharmacology, and I greatly appreciate that. If you got comments, suggestions, feel free to reach out to me at mededucation101@gmail.com. As always, go back to reallifepharmacology.com, and you can look at the entire list of medications. I got them organized by disease state on the right-hand side. So if you're studying for a particular, board exam or a particular pharmacology topic within college, for example, definitely don't hesitate to utilize those podcasts organized by category there. So go check that out at reallifepharmacology.com. Again, email me, mededucation101@gmail.com, or you can track me down on LinkedIn as well. Eric Christensen, PharmD, BCPS, BCGP. I'm going to sign off for today. Thank you so much for listening. Hope you picked up a few practice pearls, and have a great rest of your day.